Hi guys, I wanted to show you guys a couple of things that I got for myself for Christmas. So this is just one item. The other thing is downstairs, which I will bring you guys downstairs in a little bit to show you. I just had this insane sensation to sneeze and it's now gone. But as you can hear from my voice, I'm still recovering from the flu. A lot better than I was last week, and I actually had energy to go to the gym today, but just still like really under the weather and still congested, which I don't really understand why it's taking so long to go away. Speaking of the gym, I got new running sneakers. So these are the Cloud Monsters in the color Moon Fawn. I tried these on in the store and I really like them, and these are kind of a cute color, so I thought I would pick them up. They look like this, and they've got, you know, the iconic holes on the bottom of the shoe. I have wide feet and these fit me really well, so if you are in the market for some new shoes, definitely maybe try these out. And then another thing that I got, well, this is something that I bought for myself, and then the other thing that I'm about to show you is something that my parents actually got for me. Okay, so I needed a new like dresser in my room because I had all my gym clothes in my closet, and it was just overflowing to the point where some of my leggings were either just like sitting on the floor or, you know, not in an actual space. So I got a new dresser. This is from IKEA. I think it's called the Brimsney. It fits really well. I was making it over the weekend. Took a couple of hours because I kind of just wanted to do it on my own. And I was moving around and picking up the furniture, and it was so heavy. And at some point, I literally thought I was going to throw up. And it just wasn't feeling well. But I decided that I wanted to do it by myself. My dad was asking if I wanted help, and I was like, no, I got this. And so I made the whole thing. So I'm going to show you guys what it looks like. Okay, so here I have the Alex drawers. This I've had for a very long time. So I feel like if you've been watching my videos, you would have seen this way long ago. Here I have like some of my makeup products and stuff like that, and then a lot of my like contacts and just other stuff that doesn't really need to be seen are in the drawers. And then this is the new cabinet. So this is the Brimsney. I have on top my jewelry holder, just like some like picture frames with some stuff. This is actually one of the bracelets that I got from the Eras tour. Like, some little boy came up to me and asked if I wanted to trade bracelets, which I thought was really funny. And so I have all my like concert bracelets here. This is just Apple Watch like replacement band. But up here I have all of my like undergarments, and then I think in here is my gym shirts. Yeah. So I've got my gym shirts, my gym bottoms here, and then so the last one's all my scrub stuff, so that's why it's all like color coded. I thought it was a really nice gift because I genuinely had nowhere to put my gym clothes, but now I do. So if you guys are in the market for a new dresser, it's pretty nice. I like that the top one is clear. I think it's glass, and then the rest are just like the regular cabinet. Okay, so I am still working right now. I have my computer right here. You guys can't see it, but I just got a new email, so I have to call back this patient. The other thing that I got for myself for Christmas is this new hard drive. So I originally had another one. I forget what the company is. I think it was like Western something. I used to keep it in my laptop, so you can see like the little flap here. It got loose and fell out, hit the floor, and then when I tried to plug it in, it like would not read the hard drive anymore. And so I was really, really sad because I had some footage on there. I had all my stuff from school. I had just like videos from old concerts and stuff that I really wanted to keep on a hard drive. And so I lost all of that. It wasn't too like important to the point where I couldn't, where I needed it replaced, but I wanted a hard drive because this is what I use to edit. And I've seen a lot of people on YouTube have this exact hard drive. So I did some research and it seemed like it was a pretty good, solid hard drive. So this is the Lacey 1 terabyte. I'm gonna call this patient back and then I will prep for dinner today because I have tennis later tonight and I want to eat before I go to tennis. Hello guys, I got a haircut today. My hair is still pretty long, but before this it was even longer, and I got it because Chinese New Year is next month and I just thought that I would get a head start at this because my hair is so long right now. As it gets closer to Chinese New Year, it just gets crazy to get a haircut, so that's why I went today. So my idea was to either do this, which I want to go through some questions for the pants and kind of quiz myself to see how much I remember, because it's been a while since I've done questions like this, and I thought that it'd be a good way to kind of refresh my memory. I'm not due for my pan-re for another 8 years or so, but I just think that it's always nice to kind of refresh and see what I know and how much I've retained since graduating school, basically. And then the other video idea that I had was to watch some of my old rotation videos to kind of go through memory lane and see if I have like more insight from a perspective like a couple years later, and see if there was anything different that I would have done or new advice I could give you guys from someone who has experienced it and then also has clinical experience like working. So those are just two of the things that I was thinking about. Not sure if that's something that you guys would like to see, but I'm trying to come up with ideas that are different from just vlogs. So let me know if those are things that you're interested in. But I'm gonna start off by doing this one because I just think that this is a really fun concept to kind of go through. So I'm using the website Smarty Pants. I just literally typed in free pants practice exam. There are 30 questions, so I'm going to try to go through them as quick as possible and hopefully keep this interesting for you guys. So we're going to start with the first one, which says, a patient presents complaining of severe pain and burning in an extremity. You note that the extremity is pale, cool to touch. You don't feel a palpable pulsation. Which of the following diagnostic modalities will identify the source? It depends what we're worried about, right? It's an extremity, so I wouldn't say chest x-ray is going to be helpful. An echo, not really. The echo and the abdominal flat plate and the aortic ultrasound are looking for if you're having an aneurysm. And it's possible that you lose like pulsation in your extremities with that. It's more so bilaterally, I believe. And then also you are hypotensive because you're essentially, if you have an aneurysm that's dissected, you're like bleeding out internally. I'm gonna go with angiogram, and that's correct. I forgot to screenshot it, but from now on I'll do the screenshot of the question and the answer. And it is angiogram, and that is because it's for arterial insufficiency. So nice. Next question is, 31-year-old pharmacist complains of rectal pain, describes that it's severe tightness that awakes him at night. Bowel activity is normal, denies rectal bleeding and seepage. And then he says that sleep interruption is problematic because with the number of hours he works, every minute is important. Okay, that's just like too much information. What is most likely diagnosis? So if there's no bleeding or seepage, it's not hemorrhoids because he's not bleeding. That usually only comes with passing bowel movements, but even so, he's saying that he doesn't have any bleeding at all, so that's not a hemorrhoid. And then abscess could be, I've never heard it described as like a tightness before though, so I wouldn't say it's that. Perianal fistula, no, because that would have seepage. Ulcerative colitis is diarrhea, and he's not explaining that. Proctalgia fugae? I feel like that's like some false proctitis, which means that you have a sensation that you need to pass a bowel movement, but there's nothing to pass. I forgot to screenshot the question again. Oh my gosh, sorry. I clicked anal abscess. That's wrong because it says that abscess would be constant. So then I'm going to go with proctalgia fugae, which is correct. And that is rectal pain that comes and goes. Interesting. Never really learned about that because I don't think that there's anything you can do. All right, let's move this along. 38-year-old chronic smoker presents with shortness of breath and wheezing. He had several episodes in the past. He states that each previous episode began after developing a cold that moved into his chest. After treatment with albuterol and several days, the wheezing stops. He has a chronic cough, productive mucus, most mornings during the past several years. Which of the following best describes the patient's condition? He's had this for a couple years, so that's definitely chronic. He's a smoker, so you want to think COPD, bronchitis kind of picture. And then bronchitis is usually productive mucus. Emphysema is more so like the barrel chest, whereas bronchitis is the blue bloaters. I'm going to say chronic bronchitis, but also there is a option that says chronic bronchitis with hypersensitive airways, asthmatic bronchitis. I don't want to say that it is asthmatic but then like asthma can also be induced by colds, weather, change of seasons, stuff like that. So it's possible, and I don't know if they're trying to trick me. Okay, I'm just gonna go with the hypersensitive airways, which is correct. And it's probably because he has some sort of airway disease already from his history of smoking, and so any sort of new illness or virus or something that is going to cause irritation to the lining of his lungs, it's going to cause a flare-up of his symptoms. Next. Question is being treated for tuberculosis. This is something that I treat all the time. She's experiencing central scotomata, a loss of green-red color perception, and decreased visual acuity. Which agent is most likely responsible? And that is going to be ethambutol. Secondary to a traumatic event, a child complains of a pain in the index finger. An X-ray demonstrates fracture line through the metaphysis of the proximal aspect of the middle phalanx, ending at the epiphyseal plate. What type of fracture does this child have? So, if I remember Salter-Harris, so the S is something, A is above, L is something, T is through, E is erasure of the line, which means that it's like through the entire thing. It says it demonstrates a fracture line through the metaphysis of the proximal aspect. I'm just going to say 4. Salter-Harris type 4 because it says through. Okay, that's wrong because Salter-Harris is through, but it's through the metaphysis and the epiphysis. So I'm going to go with, I don't even remember what L lower? All right, we'll go with above, which is type 2. That is correct. Okay, so Salter-Harris stands for S is slight increase in space. Okay, did not remember that. Type 2 is above the plate. Type 3 is lower. Type 4 is through. And type 5, how I remember it, is erasure. So it's literally like there is no space in between the two plates anymore because it's completely gone. So there's compression. Okay, that makes more sense. I, as you can tell, did not like ortho that much in school. All right, next question. Question 6. 24-year-old male presents complaining of chest pain. He states that it is worse with swallowing and taking a deep breath. Improved with sitting up and leaning forward. Denies trauma, cold, or shortness of breath. Which of the following tests would be the most compatible with your suspected diagnosis? The things that stand out to me are the sitting up and leaning forward, and usually indicates some sort of pericarditis. That also fits with the chest pain. I don't know about the worst with swallowing and taking a deep breath, but taking the deep breath, maybe. Oh my gosh, I'm so dumb. I read that wrong. Okay, so diffuse ST segment elevations is also pericarditis. And the key word there is diffuse. The criteria for STEMI, ST elevations appear in at least 2 contiguous EKG leads. Common locations are 2-3 AVF, V3, V4, 1 AVL, V5, and V6, or V1 through V4. Okay, so yeah, the key word there is the diffuse, which means that it's in all the leads, versus STEMI, where it's just in some.
Good morning, guys. While I sit here and get ready to go to the gym, I'm waiting for my car to warm up a little bit, but I kind of wanted to go over what happened in the beginning of this week. So I usually have class, like tennis classes every week. Showed up to class this week, and when we were warming up, one of my classmates fell. He ended up, like, in the very beginning, after he fell, he couldn't really speak. I think he was in shock, really. So I kind of just like gave him a little bit of space to calm down a little bit. While he was doing that, I was assessing him just to make sure that everything was okay. And something that I've realized is that a lot of times when something happens, like someone falls or an injury occurs, everyone starts freaking out, and it's normal. It's the response that you're supposed to have because people just don't know what to do. But I think as a practitioner and a provider, obviously I don't work in emergency medicine, but we are trained to kind of, respond in situations where things are a little bit uneasy for people. So I kind of just wanted to talk about it so that you as a viewer would know what to do if something like that happened. And something that I've realized is that, number one, a lot of people start freaking out, but number two, they hover a lot, and that can kind of cause a lot of just like anxiety for the person who is hurt or has whatever episode going on. Okay, so I realized that I never finished my story, but basically, let's rewind and give a brief summary as to what happened. So he fell over. The second that it happened, I just happened to turn around, and so I saw him actually like fall over the net, and then we all ran over to him just to see like, is everything okay? And the first moment that I got there, he was having trouble speaking. I attributed to the shock, and like I was saying, something that I've noticed is that everyone was just bombarding him with a bunch of questions, and I could tell that, he was like struggling to understand what was happening, either because something traumatic just happened or, he's really scared. So I took a step back and I was just assessing the situation. And for me, it's looking to see that he's conscious and that there's no like traumatic bleed that's happening. There's no blood coming out from around his body, anything like that. And mainly my biggest concern is that he doesn't lose consciousness, because if someone hits their head, they lose consciousness. You have to check their pulse and also see that you start CPR or you get an AED, things of that nature. So a lot of times people don't know these things, and I think that it helps to have some of this information. So if you find this story interesting, then keep listening. But essentially, I did all my assessments like in my head, really. Took his pulse just to see how he was doing. It was really thready. It wasn't very strong, but I expected that because he didn't look so well. And he was just complaining of some pain. So my coach had told one of our classmates to call 911. She went to do that. And then the rest of us just kind of stayed there with him. And I specifically took this as an opportunity to now sort of ask him questions, because it calmed down a little bit. I could tell that he wasn't, struggling to breathe as much as he was before. So once everything had calmed down, I was like, do you know where you are? And also my main concern is if he had struck his head, you want to know if he has any altered mental status. Does he know where he is, his name, what time it is, and stuff like that. So he knew where he was. And then I just asked like, what hurts the most? So I'm asking him a bunch of questions now, because I'm worried about, you know, his bones, his nerves. Can you feel your fingers? Can you move your fingers? All of that was a yes. And so really, I was really just concerned that maybe he had dislocated his shoulder, or that he had bruised it really bad. But essentially, you also want to keep in mind that anyone who falls on their back as well, they could also have back trauma. So anything of that sort, you don't want to move the person. The reason being because if there is specific damage to the spine or the C-spine, which is your cervical, like your neck area, you don't want to move them in case moving them makes things worse, meaning that you make the trauma worse. If there's something dislocated and, you know, you move them around now, their joint or their neck is not stabilized, and you can cause more damage than good. So we left him there on the floor, waited for the ambulance, which did take a while to come, which was really surprising to me. And then once the ambulance came, we were still just like hovering, and one of my classmates was just like telling the EMS what to do, and in my head I was like, guys, this is their job, they know what to do. You don't need to kind of like dictate for them. You kind of just need to tell them what happened and they will take it from there. So I really just wanted to make sure that everything ran smoothly and that he was okay. And one of the things that after the fact stood out to me that I did, because I'm not, like I said, I'm not an emergency PA, and so it's not in my, I'm not used to responding to these types of events. Although my practitioner side came out and I was, you know, trying to make sure that everything was stable, my other concern was that I wanted him to feel like he was not alone in this sense, because one of the like workers, because I'm in a class, one of the workers came out and was like, you guys can go to the other class if you want so that you're not missing your lesson. And specifically for me as a medical professional, we've taken an oath to take care of people. And when I'm on the court, whether or not I'm at work, on the court, off the court, at work, I'm still a medical provider. And so I didn't feel comfortable leaving him there by himself to kind of, you know, just wait for the ambulance. So I sat with him, and I think he really appreciated that, because could you imagine you just fell and you're laying on the ground, you can't really move because you don't know what's wrong, what's broken. Everyone is kind of running around doing their own things, calling 911, getting your belongings for you. There's other classes going on around, and you're just laying there. You can't really see anything. You don't know what's happening. And all you can really do is look up at the ceiling and use your ears to hear what's going on around you. I think that it'd just be nice to have someone who's next to you who, you know, has a calm exterior. And I think in that moment, I think that I brought some sort of calmness to it, not only because I was a medical provider, but because I wasn't hovering and causing like so much panic about what was happening. Did tell him that, you know, I'd be concerned that you might have dislocated your shoulder, or, you know, you might have broken a collarbone or something like that. But I didn't really want to give him any more anxiety than he was already feeling. So I just kind of sat there with him and let the ambulance do their job. Long story short, he did end up breaking a couple bones. It wasn't his shoulder or his collarbone, but he broke a couple ribs, and that can be super painful just because when you take breaths and you breathe, your ribs expand. So imagine now you have these broken ribs that are not displaced, but they're going to constantly be moving because you're breathing all the time. So it's just going to hurt. But the healing process is really just supportive and pain management. So you kind of just have to ride it out and let your body do the work, which is very unfortunate for my classmate. But that was the whole event, and it was actually really scary because I've never seen anyone fall like that. So yeah, I wish him a speedy recovery and hopefully everything goes well. But right now, I'm waiting for this Bridgerton to Doom event to start. And it was supposed to start at 12:30. It is now 2 o'clock. And this is what I'm looking at. It still says, we'll be right back. I don't know what happened, but Netflix intern definitely getting fired today.